Hello, it's Dr. Erica, pharmacist and founder of Millennium Pharmacy. Please like, share, and also don't forget to subscribe to this channel. This is Dr. Erica. In this particular video, medical topics, I'm going to talk about lupus systemic disease, which is a rheumatologist or immunologist uh, origin disease that is um, very important because this particular disease does not have a cure. There are a lot of research and tests behind the medications. However, the medications are not promising as far as being a cure. Now, patients do require a team of specialists, support, family support, also community support, because this disease is very rare but very serious. It does occur most often in Asian and also those who are African Americans. Now, this particular disease does occur in young adults, ages 20 and ages 30. Now, this particular disease is a disease that causes flare ups where the patient may experience signs and symptoms of inflammation in their skin, in their face, also all around their body areas. Their internal organs even may become inflamed to the point where they have to receive immediate medical attention to maintain life. And then also, once they are stable, these particular patients will have to go on a medication regimen to help with maintenance and so forth to prevent these flare ups and emergency hospital visits. Now, once these flare ups occur, they can occur and attack the body, any organ system, whether it be the brain or the kidney, whether it be the liver or the heart. Now, all organ systems are fair game when it comes to lupus systemic disease because the immune system itself does not know that the body is itself. The body begins to eradicate because the immune system undergoes processes to get rid of organ systems. Now, this is a very serious disease because patients um, are usually tired or fatigued and they require uh, like maybe short hours. If they're able to go to work, they require short hours of work. They require short hours of standing and things like that. However, some of the symptoms and the flaring and the attacks can be subsided with exercise and proper dieting as well. So, and then of course the medications, because the medications are paramount in the success and longevity of life for these particular patients. Now, some of the medications that patients may experience using while being treated for lupus includes NSAIDs, which are non-steroidal anti-inflammatory drugs such as naproxen and ibuprofen, and then also uh, steroid medications or corticosteroids such as methylprednisolone and prednisone as well. And then there's other classes of medications that I'll mention such as anti-malarial drugs. And then there's also um, cyclophosphamide, and then there's another class that's more serious going along. Now, the patient may not experience using all of these particular classes of drugs, just depending on the stage of their diagnosis, whether they are early stage, mild stage, or we call that the earlier stage. And then there's the moderate stage, which is the more progressive disease. And then there's the severe stage, where the patient is in severe critical state. And all three of these stages are very important and require some sort of medication to maintain stability. Now, the medications that a patient may be started on are going to be, like I mentioned earlier, the NSAIDs or ibuprofen around the clock. They'll be using these medications around the clock to maintain the maintenance of life on a daily basis for those who have the mild form of the disease. Now, the moderate and severe form will require more medications, of course, we know that. And then these medications will have more side effects and more intervention as research occurs. They'll have more research behind them, and they'll have more stability as far as the outcome. So that is good as well. And the medications that I want to mention are going to be the hydro or the PLAQUENIL, the medication that you've probably heard about in the media called PLAQUENIL, and it is a medication that is primarily going to affect the immune system, and then it's going to have side effects on the retina of the eye, or called retinopathy. So we do want to be aware of that, and then also it can cause other side effects as well. It's not cost effective at all. That's one thing I will mention as well with these medications. They are not cost effective. I've had patients to come into my pharmacy and ask about the pricing. And so a lot of people have to, especially for minorities, African Americans, they have to really budget their income in order to provide for their medication administration and dispensing, because these medications are not cheap because of the progress of the disease. And so some companies may not even be able to manufacture these medications. And so a lot of patients may experience the back ordering of the pharmacy, and which is the pharmacy's end of handling inventory. However, with the manufacturers who produce these medications not being able to produce them on a consistent basis, patients have to usually be on schedule when filling these medications and taking these medications regularly. So there are some drawbacks to these medications being available and being cost effective. Again, Plaquenil is one of those. And also another one is azathioprine, which is called IMURAN, which is another medication that is very expensive. It's available in the pharmacy, and then again, it may be available from the manufacturer, or it may not, just depending on the timing of filling the prescription and getting all of that ready. So I do recommend patients who are dealing with lupus and wanting to get their medications consistently on a weekly or monthly basis, do budget your income, because these medications are very expensive. And so most insurances will cover for these. And because some medications might be considered specialty medications, they are going to be not so cost effective. So I do want to warn you up front about that. And then also the manufacturer's production of the medication may be a little bit halted because of the cost of getting these medications manufactured. So do take that in consideration. Now, there are other, again, steroid medications or corticosteroids that are used in the beginning as a restoration from a patient being under attack. But again, these medications do have side effects. The corticosteroids do, and so they can't be used long term. They can be used for a short period of time, but not long term, because of the number or numerous side effects, which could include increased cholesterol, increase blood pressure, and so forth. So if you've ever taken a corticosteroid such as prednisolone or a med pack, then you understand that they're only used for a short period of time because of their side effects, and they will affect the immune system. And so, because of that, they are very, very effective in treating lupus. However, the side effects will cause the medication to not be used for very long periods of time. So I do want to make mention of that. There are also another class or another medication for very, very severe cases, and that's going to be the cyclophosphamide. We recommend patients drink plenty of water, 2 liters of water per day for this medication because it does affect the kidneys adversely. And then also with other medications that I mentioned, the kidney function is very important because these medications require complete clearance through the kidneys, and because a person who may be dealing with lupus disease, the kidneys are also an organ system that can have failure and can be under great great depletion because of the disease itself. And when the kidneys become less and less functional, medications become more and more accumulated in the body, causing side effects or adverse side effects that we never wanted in the beginning. So do be aware of that. I just want to make mention that the medications that are available for lupus, again, are not cost effective, and sometimes they're not manufactured or produced on a regular basis. So lupus patients are dealing with not only the lupus disease, but they're dealing with also the medication pricing and then the medication production. So do be aware of that. Lupus is a very serious disease affecting all organ systems, including the spinal cord and the cranium, and then also every organ system of the body. The body does not know itself anymore, and so the body begins to quickly uh, just deteriorate, and organ systems quickly begin to fail, including the heart and the cranium, and then also the skin as well. So do be aware that if you know anyone with lupus, please hand out this information, uh, get to know them, encourage them, and do be aware of what they're going through, to be sympathetic and empathetic with them as well. So thank you for joining me for this particular video. That's all I wanted to share because, like I mentioned in another previous video, there was a great family friend that recently passed because of this disease, and they were dealing with this disease, and so I'm sure they came across a lot of the hurdles and a lot of the setbacks about the medications and the amount of support that would be required. Numerous rheumatologists, numerous immunologists would have to come together for a particular lupus patient to make sure that the patient is educated and stable and knowledgeable about their prognosis and diagnosis and so forth, and can be more realistic about the disease and know that they are under great care. So if you know anyone, please share this information with them, pass this information along, and I hope that everyone has a great week. And this is all I had for this particular video. I'm Dr. Erica, pharmacist. Please like, share, and also subscribe if you haven't already. And I hope to see you on the next video. Take care. Bye-bye.